My guest today is Virginia Hoft, Executive Director of Mental Health Connection of Tarrant County. So your nonprofit recently released a report that examines areas of the local mental health system that are currently stressed. Before we talk about that, tell us about your nonprofit.
Thank you so much for calling this issue to light. It's a really important issue. So the Mental Health Connection, we're a collaboration of dues-paying members. And we began about 20 years ago as a result of a shooting at the Wedgwood Baptist Church where an untreated man with mental health issues came in, turned the gun on some folks that were there, and then turned the gun on himself. And so that kind of was a catalyst for us to come together and look at, this is 20 years ago, look at where are the gaps, what's going on with people not getting the services that they need. And so the mayor at the time pulled together a group of agencies and said, we got to address this. We have a collection of members that range everything from the county to hospitals to social service delivery systems. And what we realize is that when we come together united, that we are better together and stronger as a group than we are individually. So that is the role of Mental Health Connection, is to provide opportunities and vision and just kind of the framework for us to have a collective impact on mental health services while we address emerging needs that are coming up.
Very important. Okay, so this report, you have 4 areas of the local mental health system that are stressed right now. So what led to the need to this report, and what did you find?
What we were seeing is that depression, anxiety tripled. It tripled since COVID. And that family violence rose by 22%. So that's like almost 25 more cases per 100 folks. There were more intimate murders, partner murders, than more than doubled. And then Cook's Children released a report that showed that suicide among young people was a leading cause of trauma with COVID, surpassing child abuse and car wrecks.
Okay.
So when we looked at that, what we decided is that we need to come together as a unified group with a unified message and put together a report that addressed all the individual needs of our members, because we know what's going on. And then what we saw is that need went up, services went down, wait list, it just expounded. We went from wait list, right now, wait lists are anywhere from 4 weeks to 6 months based on what services you need. So we wanted to be sure that we had a collective voice, that we could speak to the public and that we could speak to the county to say, this is where our needs are and we have to address this.
Okay.
In a crisis, you begin to just deal with what's in front of you. And then when you start getting in that cycle of dealing with crisis, then it's hard to step back and be creative and think through solutions, because you're putting out fires.
What else needs to happen in the coming months and years to kind of address these issues you pointed out?
So there's micro issues and there's macro issues.
Okay.
And I was watching some congressional hearings the other day on C-SPAN, and there's a lot of attention at the national level about workforce shortages and about how long all the loopholes that people have to go through in order to access mental health. That that there's not a lot of parity. That if you show up in an emergency room and you're having a heart attack, there's no question you need services immediately. But a lot of what happens in mental health, because of the stigma and all the things that go around it, if you show up saying you want to commit suicide, there's a lot more hoops you have to jump. So nationally, we're looking at the parity around mental health and physical health have got to be seen as more equal than behavioral, if you will. And then the other thing is that we're pulling together the leadership of the Mental Health Connection members that did the report, and what we're going to do is we're going to take that workforce issue, and so some of it, one of the biggest problems is that nonprofits pay a lot less than for-profits. And that's part of the systemic problem. So we're going to have to figure out how to address that, or get creative about somebody coming out of college. How are we going to lure them in to coming into public health, and how are we going to get what we pay them up, which is really tricky because it's in a public setting. And then, but the things that we can do is that we can learn ways. And I was at one of our partner organizations the other day, and they just moved into this new building, and they had this fireplace that was left from an old building before it was their center, and she's like, this fireplace, what I've noticed is that people are coming out of their offices and they're sitting in front of the fireplace and they're talking and they're kind of debriefing. And it's that kind of connection that we want to be able to bring to the staff, because stress makes people feel isolated, and if connection really addresses that. So there's those kind of things that we can do together. And then the other thing is that we are working with the county. We're working with the county saying, this is what we need. We have an opportunity here to really do some creative things and pulling together the folks. This report was the first step. The report's like, this is what the problems are. Yeah. Now we're going to take that and we're going to say, okay, so let's think outside the pot. Let's get creative. We got a strategic plan that we're doing this year. Let's look at what's going on, because this is not the environment of 10 years ago, much less 3 years ago. And we're going to have to think different.
Okay. Well, you've obviously spent a lot of time analyzing the problem. I hope our local government supports these suggestions. It's incredible the work you guys do, and we could probably talk for hours on this subject.
Yeah,
Unfortunately, we can't right now. But thanks for the work you've done putting all your research into this topic and for getting out to the public. And if folks want to visit your website or social media to learn more, where should they visit?
www.mentalhealthconnection.org. But we also have a public-facing website and program that is geared towards folks wanting to learn more about trauma and stress. And that's the recognizeandrise.org. And that's a great resource for the public.
Okay, so folks start at that website and start learning and getting engaged and finding ways to support nonprofits like the one that Virginia is ahead of. Thanks for your time, and I wish you the best of luck in all of this.
Thank you so much. I really appreciate it. Really appreciate your time.
Our pleasure.